Hi, I'm Gloria, and welcome to the Wound Treatment Center.
Well, I grew up in Washington, and when I was 10 years old, I was diagnosed with diabetes. And in the early 1980s, I moved to California. About 9 months ago, when I went to the diabetic care clinic, they found an ulcer on the bottom of my foot. And with diabetes, you tend to lose sensation and feelings. When you don't have the sensation, you don't know how bad the wound is. And it can be scary, and it's very difficult for me to be aware of what's happening. The care clinic started me out with antibiotics and gauze, and that just didn't seem to be working. And so they referred me to the wound center at Watsonville Community Hospital.
Family practitioners have a difficult time in actually assessing why the wound is there and then coming up with treatments. They just don't have the training. So it's really in the patient's best interest for their primary care to look at the wound and acknowledge that it would be best to be seen by somebody who's a specialist.
Well, we receive referrals on many patients with diabetic foot ulcers. That is the predominant reason for referral to the Wound Treatment Center. Typically, these are wounds that have had some degree of conventional wound treatment in other offices at their primary care physician, for instance, or even podiatrists out in the community. By the time we receive the patient, they've usually had conservative wound care for about 2 months. When the wound isn't responding with that, an appropriate referral is made here to the wound center for advanced wound modalities.
Our first goal would be to really find out what caused the ulcer and address the cause of the ulcer. Generally, if they have a vascular problem, then we need to do something to improve the circulation. If it's just a pressure problem, we want to relieve the pressure. If she has an infection, we want to clear up the infection. And along the way, we want to educate her and give her the tools to work with so that once we get it healed, the ulcer won't come back.
We offer a wide range of wound treatments here that really aren't available anywhere else in the county of Santa Cruz. Those wound modalities include growth factor therapies, particularly for diabetic foot ulcers. That would be an indication for use. We also offer negative pressure therapy, which is a dressing, which is an advanced wound modality as well. And then hyperbaric oxygen will be the newest and greatest modality that we'll be offering. And we can offer all three of those modalities at the same time.
Having the wound center local is huge for the community, not only for convenience, but it allows us to act very quickly on these difficult wounds. And sometimes there's only a certain window of time to really effectively help wounds before they go bad. And having the wound center here makes it easier for us to begin treatment in a very effective and expeditious manner. Limb salvage, that is our #1 goal. And we have a high success rate here.
I think the big picture is that diabetes is on the upswing. Obesity and poor health is causing a number of wounds that are very, very difficult to heal. Sometimes it's a long haul, but with a clinic like this, bringing in the nursing staff and the support staff to keep people on track and spotting things that would normally interfere with healing have really improved our outcomes dramatically. And I think the hyperbaric chambers are going to help us heal the most difficult, the toughest wounds, the crush injuries, and as well as burns and certain diabetic wounds that almost for sure would have gone on to amputation.
The hyperbaric chamber is another way of delivering oxygen to tissues and allowing wounds to heal more rapidly. And that's the concern. It's having a wound heal in a timely fashion, and it decreases the risks that a chronic wound engenders, which is principally systemic infections, the possibility of limb loss, etc. So the hyperbaric chamber is going to afford us another modality of treatment. We have more options here. We have better nursing in general in a facility like this. We're able to see more patients. We have nurses here that deal specifically with wounds, and because of that, we can focus on wound care. To have that down to a science is not an easy thing, and the nurses here are focused solely on that. And so we take patients from all over the county and from some of the surrounding counties to this clinic because of the specialty, principally in the nursing staff.
The patients are often very nervous at first, but then we gain their trust. They can see very quickly that we do have expertise. Even the medical assistant, knowing their job inside out and backwards, and then the RNs to the physicians, and as a team, I think we really gain their trust rather quickly. By the end of the first visit, there will be a handshake on the way out. They know they're in good care.
The staff, the doctors, the nurses, they were great. My foot did heal, and I'm very thankful to that because I could have run into bigger problems and possibly amputation if it hadn't held. So I'm very happy with the wound center at Watsonville Community Hospital.